αυτό ήταν σχεδόν απαγορευμένο για μια γυναίκα και έτσι στράφηκε στη Γαλλία, στο Παρίσι, όπου απέκτησε το πτυχίο της το 1894. Θα πω και ένα ανέκδοτο που δεν είναι στο κείμενο. Όταν εμφανίστηκε στο Ελληνικό Πανεπιστήμιο, στο οποίο γράφτηκε, εμφανίστηκε στο αμφιθέατρο, άρχισαν όλοι οι άνδρες συνάδελφοί της να φωνάζουν ρυθμικά «Σκούπα και φαράση, σκούπα και φαράση», οπότε σκόθηκε και έφυγε. Αυτό είναι μόνο για τα ελληνικά. Η ζωή της Καλοποθάκη μπορεί να χωριστεί σε 5 μεγάλα κεφάλαια. Το πρώτο είναι η εκπαίδευση των νοσηλευτριών, των νοσοκόμων. Μέχρι τότε δεν υπήρχαν νοσηλευτικές σχολές και εκείνη τις δημιούργησε πρώτη στην Ελλάδα. Δεν υπήρχαν δηλαδή εκπαιδευμένες νοσηλεύτριες. Εκείνη ξεκίνησε την εκπαίδευση των αδελφών νοσοκόμων. Δεύτερον, η δημόσια υγιεινή και η φυματίωση. Τα μεγάλα στρώματα του ελληνικού λαού δεν ήξεραν κανένα κανόνα υγιεινής. Επίσης, τους κανόνες υγιεινής τους σχετιζόμενους με τη φυματίωση. Η Καλοποθάκη δίδαξε σε ένα πολυεπίπεδο χώρο όλους αυτούς τους κανόνες και επίσης συμμετείχε πολύ ουσιαστικά στην έρευνα για τη θεραπεία της φυματιώσεως εκείνη την εποχή και με τα μέσα που υπήρχαν. Το τρίτο κεφάλαιο είναι ο ηρωισμός της στους ελληνικούς πολέμους. Έλαβε μέρος στον λεγόμενο ατυχή πόλεμο του 1897 και επίσης στους Βαλκανικούς πολέμους του 1912-13. Το 1897, φέρνω μια μαρτύρια, σύμφωνα με κάποια κυρία η οποία ήταν από τη Λάρισα και είχε βρεθεί στον Βόλο και παρατηρούσε τα γεγονότα, και ενώ οι Τούρκοι έμπαιναν μέσα στον Βόλο, ήταν η μόνη η οποία έμεινε στο νοσοκομείο στο οποίο είχε ιδρύσει στο Βόλο, ενώ όλοι οι άλλοι άντρες και γυναίκες συνάδελφοί της έτρεχαν να σωθούν. Εκείνη καθόταν εκεί για να περιποιηθεί τους τραυματισμένους. Τέταρτον, τόσο στον τομέα της υγιεινής, με ειδικό εγχειρίδιο και με την έκδοση ενός περιοδικού με μικρή ζωή 5-6 χρόνια, που ονομαζόταν Υγεία, όσο και στον τομέα της θρησκευτικής ποινήσεως και της μεταφράσεως, η Καλοποθάκη προσέφερε με την πένα της. Πέμπτον, η Καλοποθάκη ήταν μια γυναίκα που ζούσε τον χριστιανισμό της. Στους φτωχούς ασθενείς της εποχής της, όχι μόνο δεν έπαιρνε την αμοιβή της, αλλά τους αγόραζε και τα φάρμακα. Είχε τη φήμη της Αγίας. Με την έλευση των προσφύγων το 1922, ίδρυσε οικιατρία στους προσφυγικούς συνοικισμούς. Έζησε πάντα φτωχή η ίδια και παροιμιώδης ήταν η ταπεινοφροσύνη της. Τα έργα και οι μέρες της ήταν και είναι άγνωστα στο ελληνικό κοινό. Ευχαριστώ τους δημιουργούς αυτού του Συμποσίου, Μαρία Καλοποθάκη, γιατί τιμούν κάποιον πραγματικά άξιο τιμής. Πέθανε το 1941 ακούγοντας τις νικηφόρες μάχες του ελληνικού στρατού στο αλβανικό μέτωπο. Ένας προσωπικός λόγος. Ζούμε στην πατρίδα μας μια ανεπανάληπτη κρίση. Πιστεύω πως όπως πολλές άλλες φορές η ομογένεια της Αμερικής στο παρελθόν βοήθησε. Πιστεύω ότι και με αυτό το συμπόσιο, προβάλλοντας πρότυπα τέτοιων ανθρώπων, βοηθάει για ακόμα μια φορά εμάς που βλέπουμε πάρα πολλούς ανθρώπους στην Ελλάδα να καταραίουν ως πρότυπα. Και γι' αυτό σας ευχαριστούμε. Maria Kalopothakes was born in Athens in 1859, daughter of Michael Kalopothakes, a medical doctor from Athens, Greece, and Martha Hooper Blackler from Marblehead, Massachusetts. She studied in Greek and American schools and graduated from the Harvard Annex, now Radcliffe College. Before returning again to Athens, she obtained permission to follow the nurses in their round of duties in the Massachusetts General Hospital in order to get an idea of hospital training and to see if she had the strength to witness autopsies, operations, and deathbeds. She had in mind a practical application of her knowledge in establishing in Athens an order of Greek deaconesses after the Kaiserwerth plan of nursing, as it was then known, as a vocation with Anglo-American methods. Athens in the early 1880s was still deeply conservative, and as regards women might be described as intensely mid-Victorian. Athens had not as yet been confronted with the problems of higher education for women. It was to Paris, France, that she, the first Greek medical woman, turned for a medical education. She was admitted to the Medical School of Paris University in October 1886. There, for 8 years, she enjoyed equal rights and privileges with men in lecture room, laboratory, dissecting room, hospital wards, and operating room. Her thesis had the title Troubles et lésions gastriques dans la dyspepsie gastro-intestinale chronique des nourrissons, functional disorders in chronic gastrointestinal disorder in infants. This thesis was followed by a monograph based on research on the development of the stomach glands in the fetus from the 6th month to birth. She returned to Athens in 1894. The life of Mary Kalopothakes can be divided in 5 chapters. The first, the training of the nurses. The second, the public hygiene and the treatment of the tuberculosis. Third, the patriotic and heroic woman, medical doctor at the Greek wars. Fourth, the writer and poet. 5, the Christian and philanthropist. Last year, on the occasion of the first Mary Kalopothakes Symposium, Mrs. Kokolis gave you an overview of the life of Maria Kalopothakes. Today, we are going to turn to the first of these chapters, the training of the nurses. A war in 1897 between Greece and Turkey was the trigger that started the training of the nurses in Greece. Together with other pioneer women, Kalopothakes helped in the front of the ill-starred War of 1897. This war, so disastrous for Greece, had good results for medicine. The medical women, with Mary Kalopothakes in the front, organized the first training lessons for nurses in Greece. Before that, there were no trained nurses in Greece. Ladies, non-educated, that would help the doctors or help the patients, existed, but they were no more than good cleaning ladies. They were not trained, and nursing was not a profession. For the needs of this war, English head nurses had to be imported from the UK. So Kalopothakes started a daily intensive training by lecture and demonstrations to a crowded audience of women of every age and rank, and special training to those who showed special aptitude for greater responsibility. During this war, the Union of Greek Women placed at the disposition of the Greek Red Cross, in an incredibly short time, a perfectly equipped hospital for the seat of hostilities, and prepared another as a base hospital in Athens. The seat of hostilities was Volos, a city in central Greece, which was chosen because of the facility of transferring wounded soldiers to Athens by hospital ships. The staff was composed by 2-man surgeons, 2 lady surgeons, Kalopothakes the one of them and the head of them, 20 volunteer nurses, superintended by 2 trained English nurses. The Athenian hospitals were full and women were finding an outlook in nursing. In this war, as in the victorious for the Greeks' Balkan Wars and the First World War, Kalopothakes and her companions gave an impulse to nursing as an education for the educated women, which has slowly developed into systematic organization and official recognition. The next year, 1898, after the war had ended, the Union of the Greek Women resolved itself into component sections of hygiene and nursing. Kalopothakes, as president, established again a clinic for women and children and trained nurses equipped out of the surplus of the war hospitals. The training of the nurses continued in the hospital, which had now become principally a surgical clinic in gynecology, with a large outpatient department, with a special training for midwives, who were in more demand than doctors. But there were no trained midwives, so she trained midwives too. District nursing was started on a small scale to be supported by this hospital. This was then the beginning of the nurse training in Greece. This work continued through the years until the Balkan Wars of 1912 and 13, in which not only the Greek army was victorious, but also through Kalopothakes' efforts, the medical sector was organized in perfection with trained nurses ready to accept the wounded. The training of the nurses continued to be a matter of big interest for this woman doctor until the end of her life in 1941. In conclusion, the presence and efforts of the first Greek-American medical woman, Mary Kalopothakes, resolved the problem of the non-existence of trained nurses in Greece once forever. In having this Mary Kalopothakes Symposium, you honor not just the first woman medical doctor in Greece, but a true pioneer. Thank you very much.
Stella, over here. I think we have everyone, and our aspiring group here, the next generation.
We saw your
We're going to get a suntan.
It is a great honor, and I deeply appreciate it. Thank you. And thank you for supporting women in science and medicine.
We're very proud of our female colleagues, and as you notice, we have a good reason to be proud. So, again, our speakers really give us an overall perspective. Dr. Tsevas showed us the proud footsteps that we're following in. And I think the example is, in organizing this event this year and also last year, things that our female police can achieve. I think we should take an example, the males. I think that Greece would also benefit greatly if the women were allowed to take charge and to put things in order. I remember that movie, My Big Fat Greek Wedding, where their father was saying, oh, what he's doing, everything else. And then the mother don't worry about it, because the woman is the neck. She turns this way, the head turns that way. She's the head of the family, but we manage it. Thank you.
Bravo.